Welcome to the 5th annual Orthopedic Symposium here by Pilgrim Orthopedic Associates. Yay! The crowd went wild. So we're really excited that you're here. The nice thing about living in Massachusetts is that, we have rainy days. Now, we could live in LA, but if you live in LA, you wouldn't have a World Series champion. There you go. Okay, who stayed up till the 3:30 in the morning for that game? Okay, there you go. Wow, look at those hands go up. Well, at any rate, so this is a great place to live. It is rainy, it's cold, but we love it, and here we are today. So, and we have a bunch of winners, and that's why we love it here. So I would like to start off by talking about our sponsors. They're the ones who are helping us out pay for this function, and our premium sponsors today are NuVasive and Abbott. We have educational sponsors, Ferraro, Forbes, DePuy, Synthes, Lifespine, Pacera, Medtronic, V&A, Cape Cod, Flexion, and Isto Biologics. Then we also have more sponsors, Bayada, Mallinckrodt, Surgicare, Kindred at Home, Spalding Rehabilitation Network, Bravo Benefits, Associate X-Ray Imaging, Lima Corporate, Orthofix, Konica Minolta, Precision Spine, and Bioventus. So I'd like you to make sure that you meet all of them, and we do have a little bit of an opportunity for you to win an iPad if you sign off meeting every one of our sponsors. So that's up to you, everyone, to see if you win the iPad. That's great for you. It's great for a Christmas present, thinking ahead, and that's your opportunity there. Now, where does the money go that we get for this? It goes to the Orthopedic Nurses Education Fund. Last year, we were able to finance 9 of the nurses. How many of the nurses went this year? Anyone here? There we go. So a lot of these nurses went with us down to a little town down in Louisiana. I think it was called New Orleans. That's it. And we had, they learned a lot. They did the courses, and then they brought all that information back to Plymouth, Massachusetts. And so we've incorporated all these new ideas that we can learn on a national front right back to Plymouth for our patients and everything. So, and this is one of the events that we had, a dinner that everyone got to attend. And it was a great time. And it's also a lot of this team building, which I think is important. I'd also like to thank the hospital that we work at, BID Plymouth. The way this works in life is that as a orthopedic group, we have to work hand in hand with this hospital and have a good administration to work with, and we're very fortunate that that's worked out so well for us. But also all of you, the participants here today, because this program doesn't work unless we work with all of you collectively as well. And I'm really excited that we have this opportunity to make all this work. And you want to know how we did all this. And one of the things that's important that we do on a monthly basis, that we started doing this a number of years ago, meeting with all the nurses from all levels to the V&A, all the therapists involved with the pathway that we've made, all the way to the rehab facilities. And so what we've done here is, and it's an opportunity we have on a community basis to really get everybody in sync with our program. And we sit down collectively, we look at all the different information we receive, and we make decisions based on evidence-based medicine. And then also, for example, we were trying to figure out the right dressing to do. So we actually had a program where the nurses evaluated all the different dressings out there. We had the V&A nurses talking about what was the best one. So we came up with this great waterproof dressing for our patients. They're able to take a shower. It stays on for a week or so, and it's peeled off. And then the incision is, for the most part, we've been very lucky with healed wounds and no problems. But this is the type of collaboration that we're able to achieve with a community setting that you can't do if you're in an academic center, because it's just the care of the patient is just too almost dysfunctional. What this has done now is change our length of stay of our patients. And this is just one little part of the data that we can find. This just shows you what we've done with our length of stay on these patients over the years, and it just keeps on getting better and better. But again, this is because we're working hand in hand with the floor nurses, and then working with the VNAs and with the cooperation of the rehab facilities as well. So this doesn't happen in large cities. Now, because of the fact that we've been successful, we've also had to grow with our success, and we're really excited about the fact that we have a new building going up and will be completed in Plymouth over by the Resnick Road facility that's already over there. And it's conveniently located by Walmart. We're thinking about giving our patients those little things you get at the restaurant, you know, so that, no, I'm not, just kidding, but, you know, you can go to Walmart and you get ding, 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 it's time to go see your appointment. No, but I mean, that's an idea. We can work on it, particularly with some of the doctors if they're really late in the day, but I mean, that's the type of things we can do. This gives me a segue into introducing Mr. Kevin Coughlin. I'm really excited that he's here today. Kevin is a great administrator for us to work with. He's has great vision and has been helping us out working with a collective vision together with the orthopedic group. So with that, I'd like a big hand for Mr. Coughlin.
Thank you, Scott. Who looks more like a hospital administrator, me or Dr. Oliver? I think that's his aspiring next job. So this is great. Thank you all for coming. This is an important service line for us in the organization. And I would echo Dr. Oliver's sentiments that the nurses and the floor staff and the technicians and everybody that works in the ORs and the floors are critical to our ability within the organization to execute on these great metrics that Dr. Oliver has been talking about. You know, quality is becoming a more and more important metric for us to pay attention in an acute care hospital, pay attention to. And this orthopedic group, Plymouth Bay, has been leading the way in our environment for years on quality and execution of excellent care. And it's not just the doctors, it's the nurses and the staff that they work with, bringing best practices from across the country and the Baptist down to our organization and delivering one of the highest quality services that we have in our organization. So thank you to Scott and to his team and to all of you that work in our ORs every single day and take great, great care of our patients. Our organization has evolved a lot over the last 4 or 5 years since we were acquired by Beth Israel Deaconess. We went from an organization that, while having excellent services in some areas, I would say orthopedics being one of those, had mediocre at best services in a lot of other areas of the hospital. And after the affiliation, the focus was placed squarely on the quality of care that we're delivering in the organization. And we have, in the different metrics that we get measured with, so the Leapfrog Group is an organization that measures our quality of care as well as Medicare, CMS. We've been an A-rated hospital with Leapfrog for the last 7 measurement periods. Top general hospital in the Commonwealth designation for the last 2 years in a row. We're the only hospital in the Commonwealth to get that designation the past 2 years in a row. And a 4-star CMS rating in quality. And we talk a lot about it, we advertise it a lot because I think it's important for not just all of you that work in the environment, but for the people in this community to understand that because of the leadership of our clinical staff, including the leadership of our physicians, we've been able to significantly move the bar on the quality of the care that we're delivering to the people in our community. Orthopedics or musculoskeletal services is a growing service line, not just for us, but for all community hospitals because the population is aging. It becomes more and more important. You all get better and better every year at delivering that care. The technology gets better and better every year. Dr. Oliver asks me every year for more technology, including another robot. The quality of care that we deliver is becoming more important to the economics of the organization. So throughput's an important economic indicator for us, But quality is now something that is measured, and either we are not paid if our quality isn't good, or we are paid more if our quality is better. So we are aligned in wanting to deliver higher and higher quality. The system, Beth Israel Lahey Health, that's in the process of being reviewed by the regulators, but we are all hopeful will be formalized by the end of the year. Will have a very significant emphasis on musculoskeletal services, as well as a lot of other services, behavioral health, and some other important services that we in the community need help with. So leveraging the new members of that system, which should be the New England Baptist, we look to bring not just additional new clinical protocols, but even higher quality than we've been delivering historically with the help of all of our clinical team. So we're really excited. This is a great crowd. I can't believe how many people are here. I think it's wonderful. And again, I thank Dr. Oliver and his team at Plymouth Bay for the great work they do every day and their leadership within our organization around quality. And I thank all of our clinical staff that are here today out in the crowd for the great work that they do every day. And I hope you all enjoy the day. Thank you.